Here. So I've got a presentation which I'm going to talk through, which is talking a little bit about my journey from where I how I got involved in a lot of the public involvement work. Community work was my background first, and then public involvement, and then this kind of journey from being involved as a public contributor in maternity to now to doing a PhD, looking at how people experience being a public contributor. So it's kind of gone, it's gone to all crazy levels. So I'm going to talk a little bit about all of that, about my journey, and then hopefully it'll be helpful not only to kind of see how and why I've done the stuff that I've done and what I'm doing, but also in case anybody is interested in trying to do anything like that, like to be involved in doing a master's or a PhD or working in that way. Because for me, it was completely unknown and not something that I knew that anyone else had done. I didn't know anyone else who'd done a PhD. It was, I didn't even really know what it was. So I'll talk a little bit through that. So hopefully it'll be helpful. So I'm going to share my screen. All right, fantastic. So hopefully that should be working. I'm not going to be able to look at the chat while I'm doing the presentation, but we will have a little look at the chat afterwards. So if you have any questions, please pop them in the chat. And otherwise, I'm going to talk you through this. So as I said, the presentation is looking at my experiences from being a public contributor to doing a PhD. So at the moment, my PhD is at Warwick Medical School, and I live in London. So it's not where I actually live. It's quite remote. I'm often doing it from a distance, and that in itself is quite an interesting process. So in the presentation today, I'm going to talk to you a little bit about what my research question is. So I'll tell you what it is that I'm even researching. I'll talk to you a little bit about my background and why I decided to do a PhD in the first place. And I'll explain what a PhD is, because that is not immediately obvious to people. It wasn't to me. I'll talk to you a little bit about my PhD journey. So how I even got involved in doing a PhD, how I found out about it, how I applied, what I'm doing. What is particularly difficult for me as a PhD student, but also as a mum, as somebody who works, as lots of different things. What are the challenges and what are the joys? And I'll talk to you as well about what my research question is. And so it's all looking around co-production, which I'll kind of give you what my definition, my working definition of that is, what the research is about. And if anybody wants to, information about how you could either take part in the research or how you can find out more about it going forward. So my research, my PhD research question is looking at how power is experienced or shared or not shared within co-produced UK health research. So I'll talk to you a little bit about what all of those elements mean, but essentially it is looking at what people's experiences are of co-production. And I'm really interested in looking at what the public contributors' experiences are. So the people that come with lived experience, and that might be maternity, or it might be in wider health research or service improvement in general. So my background. So I have worked for over 20 years in community work and engagement work. So before I got involved in public involvement, a lot of the work that I did really fed into what that is and what it means to me. So for years, I was a youth worker. I used to work in Brighton, used to work on the Hollingdean estate with young people there, used to work in South London. I used to manage a big youth centre in South London, working with lots of young people. And that involved lots of different things, but a lot of creative arts work, because I'm also a visual artist. I used to work internationally, so I worked in Ecuador, in South and Central America, with young people there, facilitating arts and arts work, and all of that kind of came together. So the arts work that I did, the community work, and I've been doing that for years. But then when I got pregnant with my daughter, that's when I kind of became more involved as a public contributor. So I'll talk to you a little bit about what I've done and kind of my background within that. But essentially what happened was I was pregnant with my daughter, and then while I was pregnant, obviously I was going to my maternity meetings and updates and speaking to the midwives, but I had a very, very difficult first pregnancy. I ended up in a wheelchair in the last few months of my pregnancy. I had really, really, really acutely bad pelvic girdle pain. and it basically put me in a wheelchair for the last few months of my pregnancy, and then again on and off for about 4 years afterwards. So I had very limited mobility, and I was in a lot of pain for a long time. And I suppose maybe because of that, I'm not quite sure why, I got invited to start giving my feedback and start being involved in and wanting to improve maternity services, which I'll tell you a bit about. But I've been involved not just in maternity, but kind of work-wise in lots of different areas of health. So also within local authorities, I've worked before, had my kids, and also kind of since in local authority, councils, NHS, voluntary sector, charity and social enterprise sectors. That's kind of my area of work. And then my academic background. So this feels like so long ago, but in 2003, I completed my my undergrad. So that was a Bachelor of Arts BA in American History. So my family are Mexican and Native American, and that is why I wanted to study that. So I've always studied stuff that I love and care about. And I suppose that's still the same with a PhD now. It's the things that drive me, what I care about, what impact I want to have in the world. So with my undergrad, I was looking at civil rights movements and Mexican American women, especially, and Native American Indigenous peoples' experiences of the civil rights movements, and I'm trying to make change in America. But my mum came to England, and I'm born and bred Londoner, so this is where I live, this is where I'm based. And then I worked in community work and youth work for quite a few years, and then I did a master's at Goldsmith Uni, which was in applied anthropology, community and youth work, and I loved that. The applied anthropology part of it just sparked off all the bits of my brain that got excited about how you can do things and how things are applied, how they're relevant to our work and to my community work. And a lot of that brought in qualitative research, so how you do research in communities and that kind of how you explore people's experiences, and especially around participatory research. So how you involve people, how you do it with them, not just about them. And all of this work, all of my academic research and my work experience is always influenced and inspired to some extent by my own lived experiences. I'm sure many people here can relate to. So for me, originally it was a lot around family, my family's experiences around ethnicity, around experiences of, especially for my family in the States, how their experiences of discrimination, the impact of kind of wider social systems on individual people's lives. And then also for me around disability. So I've always had like joint hypermobility, but it never really impacted me until I got pregnant. And then I ended up in a wheelchair, and then had a whole big experience now, you know, much more mobile than I was, but still experiencing and living with chronic pain. I also neurodiversity, so I have ADHD, which I always knew, but then had formal diagnosis quite a few years ago, which was very helpful. So bringing that understanding of how we learn, but also how we communicate and how our brains work. So always applying that within my work. So that those experiences as a service user really help inform the work that I do in the community, and absolutely inform my approach within my PhD. So the values that I have are all based on these things. So equity, the creativity, innovation, reflection, using co-production, which I'll talk more about in a moment, what I mean by that. And learning. I love learning. I love the opportunity to learn about other people's experiences, to learn about and think about and reflect on my own experiences. And doing a PhD has given me a really great opportunity and time, I suppose, to some extent, to be able to make sure that I'm learning, and I'm learning skills and things that I can apply in my work. And most importantly, I suppose, as a youth worker, one of the things we used to say, and the kind of main approaches to youth work, was about starting where people are at. So starting with their interests, with their abilities, with their the literal place that they're in, you know, and that really applies within co-production. It applies to all of my community and engagement work. And I suppose that really is, for me, the fundamental of everything that I'm doing, and not just thinking about that from public contributors, but also for professionals and academics. It's, you know, it just applies to them because we're all human, and we need to treat everybody in that way, and be human in the way that we approach things. So now I'm a PhD student at Warwick University. I'm also a freelance engagement consultant. So I do loads of work in community engagement, public engagement, supporting and facilitating organisations and health professionals to work with the public and communities. And that for me is all about developing my work, developing other people's work, developing opportunities, and helping to bridge this kind of divide that we often get across service users and people with lived experiences and academics and service providers. And people are trying to build more bridges, and I hope and try and be a part of that. And really to contribute my own experiences and my learning to be able to support all of that work. So a little bit about the maternity public involvement I've been working in, because I know that's some kind of key aspect of a lot of people who are attending the talk today. So I've done loads of different bits of work, and this is just a selection to kind of, which might help in case when you guys want to ask questions at the end. So when I had my daughter, she's 12, and my youngest one is now 6. So 12 years ago with my daughter, I got involved as a public contributor with what was then called the NHS Supervisors of Midwives. And that was supporting and being part of an audit team that went to London maternity hospitals. And my job was to speak to people, so service users, so women and birthing people, and the Maternity Voice Partnership chairs at that point about what they were experiencing. And I'm writing that up in a report that went to inform the maternity audits. So I did that. I was involved in lots of different kind of maternity projects around that. And then when we had the Better Births maternity transformation, I led the participation for the North London Better Births transformation project. I was an early adopter as part of this kind of national maternity transformation. And I led a peer research project where I trained, recruited and supported a team of 15 women from North Central London, an incredibly diverse, amazing group of women who then we worked together to do research about people's experiences of maternity care in North Central London, which fed into the Better Birth maternity transformation. That then sparked another project afterwards called Maternity Voices Matter, which was a group of those women who wanted to continue doing some work. And together we co-produced some research looking at the experiences, particularly of Black and minority ethnic women. And the majority of women that we spoke to were migrant women that were being supported by a charity in North London. And we spoke to them about their experiences of maternity care. I've also been involved with the National Institute of Health Research and Social Care, so NIHR South London ARC, which means Applied Research Collaboration for Maternity and Perinatal and Mental Health at King's College, which is an amazing group of people involved in trying to engage people in maternity and improving services. For about a year or so, I was the chair of the Royal College of Midwives Maternity Voices Network, and I developed and set up their initial Maternity Voices Network, which is going fantastic. They're doing loads of work at the moment. I've stepped back from that now, but that was a great opportunity. And I still currently work with the UCL, so University College London, operative birth research, facilitating patient public involvement in a lot of the research that's happening there on operative birth, which is fantastic. And then I do loads of other work in health, youth mental health. I did a project when I was a youth worker around co-producing a film on youth mental health, developing information when North Stowe Healthy New Town was developed, in MuM, doing work around diabetes, and work with the Co-Production Collective, who is a fantastic organisation. If you're interested in co-production, I would definitely look them up. So with all of that, I was loving all of that, but often was being asked to be involved and to help and support and facilitate other people's learning. And I really wanted an opportunity to develop my own learning as well, in a more academic sense. So I ended up doing a PhD, which is what I'm doing at the moment. But not everyone knows what a PhD is. I didn't. So a PhD stands for basically a Doctor of Philosophy, or a doctorate, which is a level of academic research and study, which quite often will follow on from a master's degree, but it doesn't always have to be. So if you haven't got a master's, it doesn't mean you can't do a PhD. There's different ways you can be involved and can do it, but often it follows on from a master's. I'm doing mine full time, so that's over 3 to 4 years, but sometimes people often will do it part time and might be 7 years or more. And it's a research-based degree. So it is a degree where you're learning, but you're also following your own research. So it has to be a piece of original research. The thesis, which I'm yet to have to undertake, is a write-up of that work, which can be many words, 40 to maybe 120,000 words. And a PhD, you can pay to do a PhD. I personally would never have been able to do it had I had to actually pay for it. So I was very lucky and got a funded PhD, which meant that not only do I not pay the university to attend, but I'm also have been paid a stipend, a living stipend, which runs out very soon. So I need to get my PhD finished. But yeah, so there are ways to do it, and it can be accessible routes into doing a PhD. So if you are ever thinking about it, don't think that can't be for me. There are ways to do it, but it is a challenge. So I thought about, in my head, maybe I do want to do a PhD. I want to learn more. I want to be able to contribute more understanding about what I'm doing in my own work and think about it in a kind of in a space I have more time. So I kind of had this concept in my head to do it. I didn't really know how to apply for it. I didn't really know anybody that had done a PhD, so it was all quite new to me. I saw an advert on Twitter, now called X, and I saw an advert and I applied, and the first one I applied for was I think the application and the interviews were like within a week or two of me even seeing the advert, so it was a very quick turnaround. I got through to an interview, but I didn't get offered the PhD, but that process actually made me think, you know what, I do really want to do this. So then I applied to another opportunity, which I think I also saw on Twitter, and then got offered the PhD, which is fantastic. So got started with that. Met with my supervisors. So you generally get one or two, or sometimes more supervisors, which is someone from the university that will oversee your research and your work and support your thinking. I did loads of training courses through the university and some externally, but they were funded by the university. And then I did, which is the usual process, kind of a literature and theory review. So that's basically looking at what other literature there is out there, what someone else has written about things that you're interested in, and then looking at what the research gap is, because it has to be original research. So it's like, what is it? What do we not know enough about, or what have we not looked at in this way? So I put my my proposal together. I had done all of this work and had this kind of write-up of all this literature that there was, and then you go to what's an upgrade panel. So that's where they say, yes, you can carry on and do this work to PhD, or no, we're worried that you won't be able to do it. So luckily they said yes. Went through to ethics, which is basically putting your proposal and how you're going to do it to an ethics board. And then they say, yes, you're going to do that, and it won't be putting the public at risk, and you're going to do it in an ethical way. And that was a very interesting process for me, because ethics is all about what I want to do, but I wanted to even push it further. So I made sure that within my ethics proposal, it wasn't just a simple, yes, this is safe, but I wanted it to be accessible. I wanted to make sure that I used communication methods with people like Zoom and WhatsApp. And I wanted to make sure that it was ethical, not just from the perspective of the ethical board, but also from the ethics of my work and people that I work with. And then doing the research, which is what I'm doing. I'll talk to you about that in a moment, and writing it up, which is what I am yet to do, but have started. So challenges of doing a PhD, I really love it, but it's really hard. It's hard to do a PhD, especially full time, whilst I'm also working. So I have to work. I have to pay my bills. I have to look after my family. I have to look after myself. And so it is hard to juggle that. But I manage it. I've got 2 young kids, so by the time they come home from school, it's really hard to be sitting and doing any work and reading or writing stuff up. So time management, is really difficult. And I haven't been a student for over 10 years. So when I stepped into doing this PhD, I was like, I don't really, I haven't read academic papers in such a long time. I felt like I spent pretty much the first year learning an entirely new language. And at first I just assumed, because people had written stuff and it had been published, that it was either to some extent right or well written. And then I found out that actually a lot of stuff that I was reading wasn't that right or well written, and some of it was fantastic and some of it was not fantastic, and I had to learn essentially a language, this academic language, to be able to decipher what my opinion of those different papers or people's work were, and that's a big part of it. And then it's really hard to do that when I come from a very practice-based area. So I'm not an academic. I can work in that space, but that wasn't my background. It was definitely not my identity. So it was that kind of imposter syndrome sneaking in at all times about, am I good enough to do this? Can I understand this? Like, do they want to hear what I've got to say about this? And then I have to do that whilst managing life and all the other things that our lives entail. So, I experience chronic pain. I'm not in a wheelchair anymore, but I do still constantly have to manage pain and pain management. I have ADHD, which people may have noticed by the absolute speed that I've probably gone through this presentation at. And that has a real impact on learning, but also time management and loads of different things. But being really open about that and talking to the university about that meant that I got loads of support, which has been unbelievably useful in being able to do this. So if you are looking at trying to do a master's or a PhD and you want to kind of forward your work in that way, do seek help and do ask for support and be really open with people about that, because it will make a big difference. So yeah, there are challenges, but there's also utter joy in it. I love learning. I absolutely love challenging my own thoughts and learning what other people have thought about or experienced or write about. And the independence of a PhD is fantastic. I was pretty rubbish at school. GCSEs weren't fantastic, did my A-levels, managed to scrape through and do better and better the older I got and the more independent my learning got. And a PhD is an incredibly independent learning. And for me, that suits me really well because I get to look at and follow the lines of inquiry that I'm passionate about. and that's what drives me. And so therefore, that you get better and better at it because you're following your heart. I'm building my skills all the time. I'm knowing that I can use them. So the qualitative research I use in practice, as well as within my own research for the PhD. And I can apply that, so therefore, to not only the research work I'm doing, but also to the community engagement work I'm doing and support other people to use those skills. And I'm constantly stretching and testing myself. I'm really passionate about my topic. I suppose anyone who's doing a PhD should and is passionate about their topic, but that is essential because without it, you just wouldn't be able to put the amount of hours and time in. And most importantly for me, it's this idea that it will make a difference, so that the work that I'm doing, the research that I'm doing, will be able to support other people in the work that they do, and about ensuring that lived experience and co-production and public involvement is at the heart of our health and our social care services. So my PhD question, as I mentioned earlier, is looking at how power is experienced and shared or not shared within co-produced health research in the UK. So just a basic definition of what that means. So at the NIHR, their definition of co-production is where a research project, the approach is used is where researchers and practitioners and the public work together, share power and responsibility from the start to the end of a project. So including the generation of knowledge. So the entire point of this project, the people are involved, sharing power, or at least working to share power and challenging those inequalities that exist within that. And sharing power is one of the key principles within co-production, but it's not an easy thing to do. It's not even an easy thing to talk about or think about. So that's what I'm looking at. So the study is exploring how power is understood, how it's experienced, shared or not shared. I'm really interested to know whether issues of power are identified, and if so, how they're addressed within co-production of health research. Think about what context or support is required to enable that to happen, and to think about how some of the systems and wider structures intersect with how we experience power and power sharing within co-production of health research. So that might be on an individual basis, it might be group basis, and it might be more kind of systemic and cultural or social. So I'm not going to read the details of this, but just so that you can kind of see how my PhD comes together, different elements of it. So there's a literature review. So for me, I'm doing something called a qualitative evidence synthesis. So that's looking at what other evidence is there, what other qualitative research has been done to understand these questions of power and power sharing, and especially looking at collaborative research or co-produced research. I'm also doing a series of online interviews. So that is Zoom interviews with people who have been members of the public, people with lived experience or public contributors involved in co-producing health research. And then they're doing it's like a 2-hour interview with people, also involves some creative methods. So drawing and talking. And then when I've done all these interviews, I'll be inviting people back as a kind of what do you think workshop, so that they can help me reflect on some of the key things that I've heard, and they can help me identify some top tips for how to implement that learning. And they also have a lived experience advisory panel. So this is a group that I recruited to help me think about the research overall. So they're people who have lived experience of being involved in co-production from the perspective of the public, contributors, researchers, academics, and funders. So finally, I will share the information here with everybody, but if you want to take part in the research, you can. So if you are somebody who's been involved as a public contributor, you can send me a message, you can use that QR code, you can have a look on my website, which will give you more information about what's happening in the research. And yeah, so I can invite people to take part in an interview. That'll be happening over the next few months. But if you don't want to take part, you just want to find out about it, there's also a link where you can sign up to updates. So once I start getting the research out there, I will share and let you know where you can find out more about what I've learned. So thank you very much. I think we've now got time for some questions. I'll hand over back to Rachel and stop my share, but thanks so much for listening.
Thanks, Emily. That's really, really interesting. And it really drives it home to me how you can look at a person and just think, oh, they just look normal. And not saying you're abnormal, but you know, the depth behind the person that's sitting in front of you, of all that depth of experience and background and learning and so on, is absolutely fascinating. So thank you. I will say this, so the first thing in the chat, Michelle, who's now had to leave us, did actually say it's actually been great and she would love to talk to you. She's from Ecuador, is Michelle, and she's helped me with some other projects as well, giving some really interesting insights. So yeah, I'll pass your email on to Michelle, and we'll see how we go from there. So yes, Natalie. Oh, did anybody have their hand up? Natalie, no, you were clapping. Thank you. Would anyone like to pose a question to Emily or ask her to elaborate on anything? Go on, now, you can go first.
Yeah, I have loads of questions.
Also, I'm just going to say I'm going to stop the recording so your questions aren't recorded. It's yeah, they won't go on the screen. Just bear with me. Oh, I was going to. I seem to have lost the stop record button. Bear with me. Oh, it's there. Sorry. Yes.